This is 4 slides on shortcomings I've seen with mid-levels, and this may be me getting a bit on a soapbox, but I figured it is something that should be put out in the open. So I say to assume is to make an ass out of you and me. I see a lot of folks make the following assumptions that lead them to have problems, and personally, I don't like being made an ass of. So first and foremost is not assuming responsibility for a patient. So a mid-level sees a patient, but then assumes that either the nurse is going to check on him or the supervising provider or whoever. But ultimately, it is whoever is the responsible party. So if a mid-level sees a patient, does not turn a patient over, then they are responsible for that patient. And they're responsible for that patient while they're in the department. That person is a human being and deserves the rights and dignity and respect of a human being. They deserve to be treated as each individual themselves would want to be treated. So it drives me crazy if I go to somebody and something's going on with their patient and they don't know why or what or how. Basically, they're not assuming responsibility or ownership of their patient. Another aspect that drives me crazy is when I approach somebody and ask them why they did something, be it an intervention or a test on a patient, and they say others do it or Dr. X does it or whatever it may be. But they don't have an explanation themselves of why they ordered a test or an intervention. And that drives me crazy. I don't care if it's a bad explanation, but they should have some reasoning for it. As my wife likes to say, a provider deserves the test they order, meaning I see a lot of folks who order nonsense tests that are not necessary. Then they get a result back and they don't know what to do with the result because they don't know why they ordered the test in the first place. So you shouldn't be ordering tests or performing interventions without having a reason for doing what you're doing. And it is never a good reason to say somebody else does it, therefore I'm going to do it. That goes back to if somebody jumps off a bridge, are you going to do it as well? Patients deserve to be treated with respect and dignity. And as a minimum, the provider delivering care should know what they're doing and why they are doing what they're doing. Another area that drives me crazy is assuming what a patient wants instead of just asking the patient. So I've had, as an example, I asked a mid-level why they did an x-ray of the knee for someone with chronic knee pain, and they said they assumed the patient wanted the x-ray. In reality, the patient wanted pain meds. But you can't get to that point if you don't ask the question. And you don't have to ask it rude as if, why are you here today? You can just say, I'm thinking this, what do you think? And go from there. And it's not just x-rays, it's discussing with the patient the risk associated with CT scans. I see so many CT scans ordered unnecessarily, especially of radiosensitive areas like the thyroid with C-spines, without any discussion with the patient. And a lot of this can be removed simply by having upfront discussion of what you think professionally and what the patient is wanting. There are some tests, and I have this in another conversation, where there's an emergency, and an emergency evaluation has to be done, and then we need to do the right thing by the patient. But a lot of what we see is not an emergency in the sense of life-threatening, but you need to rule out whatever emergent medical condition exists and then discuss with the patient what they want done as a patient and try to negotiate. If somebody wants an MRI, that's not going to happen. If they want a plain film x-ray, that's not a big deal, and that's part of the patient experience. The last part is assuming someone knows. This could be a mid-level provider assuming they have medical knowledge of something that is either marginal or they don't have knowledge, or assuming that a supervising physician knows without directly discussing whatever the issue is. And a lot of this goes back to pride and humility, and I'm not here to pick a fight, but a lot of folks don't ask because they're too proud to ask. And at the end of the day, it results in patient delay in the emergency department. I've even seen negative patient outcomes because of delaying care or ordering things inappropriately. So state law mandates that we provide supervision to the mid-levels, but the only way we can provide supervision is if we're allowed to provide supervision. And all too often, mid-levels are practicing independently, which is contrary to their license and state law and can get them in a lot of trouble. So the bottom line is it's better, especially until you've established a rapport with a supervising physician, that telling more is better and getting that supervision and that input.